This evening, we are honored to have Ron Bryant, Baystate Franklin Medical Center and Baystate Noble Hospital president, and Dr. Robert Baldor, founding chair of the Baystate Health Department of Family Medicine, along with a team of doctors that he has assembled to provide an update on our newest clinical and teaching initiative. I'm going to turn it over to Ron Bryant.
Thank you, Scott, and welcome to all that is attending tonight. And thank you for your generous support and advocacy for Baystate Franklin Medical Center. It really is exciting times for Baystate Franklin Medical Center and really Greenfield and Franklin County in general. As we've gone through this pandemic, you know, in the knock on wood, hopefully we're through this fourth wave, if you will. We've learned a lot. We've learned a lot that one, you know, a lot of our primary care visits turned to telehealth. At one point during the pandemic, 1/3 of our visits were on telehealth. That has since subsided, and we're going back to face-to-face visits, which some of us prefer. But however, we have learned that is one way to provide care to our community, and we see that expanding in the future. We've seen our partial hospitalization program and our behavioral health service line go 100% to telehealth visits, which was well received by our community and our patients. And that continues to this day. We also learned about staffing and the challenges that have come with staffing, and really across the nation, what the pandemic has caused with supply chain shortages and the like. That has forced us to look at the expansion of our existing training programs and the development of new programs, especially for our patient care techs and our medical assistants that support our providers. It's going to be important as we go forward with the family medicine program to provide the support that the physicians are going to need and the nurses are going to need in the care setting. So we have to develop the programs that expand those. There's going to be changes to the composition of the workforce, right? We're going to offer flexibility and a higher number of part-time workers to create a deeper bench. It's one thing that we've realized recently that, you know, to have a strong bench means a lot. Healthcare in general relies on nurses to pick up extra shifts, or per diem workers to come in and pick up hours. And that hasn't happened recently during the pandemic because of how hard it is has been on the workers in the last 20 months. So we've got to address that. Professional development and skill building for our employees and leaders. And review and relaxing of job experience and requirements where we can, so that more folks can enter our workforce and get trained and move up within the ranks of the organization. So it'll allow more diverse and inclusive workforce environment to support our providers in the future. So that's just one thing that we've learned as we've gone through this pandemic. And it's going to be a good thing. It's going to allow us to address the workforce in a way that we haven't addressed it in the past, or I should say, we should address it in a more robust way than we have in the past. With that end, what's new at Baystate Franklin Medical Center, other than the pandemic, is that we have realized that an orthopedic surgical shortage over the last couple of months. So we have addressed that. We've entered into a joint venture with NEOS, which is New England Orthopedic Services. We have a physician that will be rotating through Baystate Franklin Medical Center on Wednesdays. He'll start his clinic hours in Northampton. He'll do his surgeries at Baystate Franklin Medical Center. And as we expand that service with NEOS, we will open up clinic hours in Greenfield exclusively for Baystate Franklin Medical Center. And more surgeons will come to do surgery in the orthopedic service line in the future. So that's very exciting for us. That's going to bring stability. So we're not behooved on one or two physicians, but a whole group of physicians that bring a service line that adds stability in the long run, which is kind of where we're going with the rest of our surgical service lines. If we look at it, we have we started a breast program through Dr. Holly Mason's service, which we have a radioactive seed localization program that started in June. This was a service that was not available at Baystate Franklin Medical Center, but by integrating with the cancer service line, the surgical cancer service line, it's a service that we now offer at Baystate Franklin Medical Center. We have 4 general surgeons at this time, one of them concentrating exclusively on hand surgery. We have plastic surgeons rotating through Baystate Franklin Medical Center on a regular basis. And in addition, we've added pediatric dental and ophthalmological surgery recently. And a few other new things we have is we finished our new behavioral health pods in the ED, which, as you know, there's a behavioral health crisis in Massachusetts and across the country. This is an upgrade to our emergency department that really is kind of state of the art, if you will, for a community hospital. Of the 3 community hospitals that we have in the system, I don't know of anybody that has a behavioral health pods as Baystate Franklin Medical Center. So we're very proud of that. And we just finished a $1.5 million pharmacy upgrade, mostly for our chemotherapy drugs, in order to bring that process up to speed where it should be. So that was another very exciting thing for us. And we're starting to see and experience our volumes rise since the pandemic hit. In 2019, we were at a level, we like to judge our volumes to that. 2020, as you know, we saw a reduction in all our volumes across the board to deal with the COVID pandemic. However, we're starting to see our inpatient volumes rise, our ancillary support services rise, which is our radiology, our wound care, our physical therapies. All our outpatient clinics are seeing increased volumes, if you will, which is a good thing. We don't want people in the community not getting the care that they need. Early on, when we opened up our doors on a full service level, we saw a lot of sicker patients coming through that normally, if they saw their care as they should for their chronic diseases, there are instances that they wouldn't have been sick. So we don't want people ignoring their hospital visits. We want people coming to see their primary care physicians. We want people coming to the ED when they have to. And obviously we have to admit them when that is warranted. So with that, I just want to mention that how excited I am for the Baystate Franklin Family Residency Program. When this was first announced, and that, it really happened. It was there was a meeting, I can't even remember how long ago. It has to be over 2 years now, maybe 3 years ago, with Dr. Andy Ottenstein, who is the chief physician executive of the system and for Baystate medical practices, and Dr. Baldor, and we sat around a table and we just talked about where the family residency program should be. And we happened to be sitting in Baystate Franklin Medical Center at the time. And when it was decided in that little meeting that we would, make a go of it and move it to Baystate Franklin Medical Center, or at least initiate it and open it in Baystate Franklin Medical Center, I did everything I could to contain my excitement. But boy, if I could have jumped up for joy and yelled at that time, I would have, because this is tremendous for our community. We do have a physician shortage. It's going to bring physicians in the long run to our community that want to live there, that want to work there. The services are going to support the specialty services that I just mentioned that we want to grow. We want to keep rotating services, specialty services through our community. The family residency program is going to allow us to do that. It's going to allow us to increase access to primary care for our community, which is a challenge for us, and we know that, and we're working on that. So on all levels, from job growth to specialty services growth to access to primary care for our community, and allow us to work on more population health and keeping our community and patients and families healthy, it's a win-win for everybody. So with that, I am going to be quiet, and I will turn it over to Dr. Bob Baldor, who is the chair, the founding chair of the Baystate Franklin Medical Center Family Residency Program. Dr. Baldor, it's all yours.
All right, thanks so much, Ron. Really appreciate hearing what you have to say, and thrilled to be able to be here and talk about things. And so this initiative all started, the development of a formal department of family medicine was all part of the expansion of UMass Medical School out of Worcester to the Pioneer Valley here, with the relationship with Baystate Health. And as we developed this, really thinking about what does this mean and how can we really leverage a department, which is in order to help with a lot of the issues that Ron was just talking about. With it's really hard to recruit primary care providers. And there's a shortage nationwide for this, and so why don't we grow our own? develop our own program and work with that. And so that's what this is all about. So the Department of Family Medicine at UMass Baystate, I'm going to read you our mission here, seeks to be a leading academic department for educating and recruiting family physicians who will provide the highest quality primary care services to the people of Western Massachusetts. Okay? So that's what we're about. And our mission then is to not only explore innovative methods for providing population health care delivery, we're going to do this while educating the Perch medical students. You've heard about the students that are part of this in the basic tenets of family medicine and integrate them into the Greenfield community. We've been very successful in doing that and having these medical students coming through Greenfield in the last 2 years since we've started this program, and to develop a family medicine training program in Greenfield at Baystate Franklin Medical Center. The other part of this function of the department is to assist across the board with recruiting family physicians and other family medicine providers, whether that's nurse practitioners or PAs, to the Pioneer Valley into Western Massachusetts. So that's our mission. Now, people ask me, yeah, what is family medicine? What is that about? How is that different than primary care medicine and so on? So I'm going to spend a couple of minutes talking to you about family medicine. Many of you may know what this is or have heard me speak before, but I think it's important to understand the concept of family medicine as a medical discipline. So family medicine actually, as a board certified specialty, got its roots here in the early 1960s. And believe it or not, at that time, there was a general practitioner movement and people were complaining because there was no more, people weren't going into primary care. They were all specializing in a medical training. They were all becoming ologists. So what happened to the old GP that was missing? So family medicine sprung up as a social good out of the 1960s to say, let's develop and address the primary care needs of our patients. So family medicine, though, is built around a social unit, that being the family, right? As opposed to a specific patient population, like just taking care of adults, like an internist, primary care internist, or just taking care of children, like pediatricians, or just taking care of women's health, like a gynecologist, or around an organ system, like just taking care of the heart as a cardiologist. And so the idea was we take care of the entire family, whoever walks in the door. So the emphasis on taking care of that family unit really is best done with a team-based approach to care. And we are taking care of both acute and chronic medical conditions. And part of this is a lot of training in common procedures. As we talked about the shortage of orthopedics in the area. Well, some of the common procedures that we can do is a lot of musculoskeletal training, taking care of some joint disorders, helping with joint injections, those type of things, and part of that. The other common procedures that we talk about are for dermatologic procedures, a lot of skin biopsies, those type of things, caring for such things as ingrown toenails, abscesses, and so on. Being trained to be able to take care of and provide those things in the office. The other part of this, though, is a focus on wellness and preventive care and integrating behavioral health. Probably 30% of the patients that we see in our offices have some sort of behavioral component to their health. That may be from smoking or drinking or lack of exercise, or it may be related to more of an issue with anxiety or depression or substance abuse. How do we take care of those people as well? So the idea to develop a formal family medicine training program at Franklin grew out of a planning process. And part of this was to sort of say, okay, how can we address those healthcare needs that we're seeing in the community? How can we train docs and other providers to come into the community and stay there? But also, how can we integrate and help support the hospital? And so in order to do this, it's a component we're going to need then to have a residency, a strong family medicine faculty, and a teaching health center, along with a full service hospital to provide the required inpatient training. And so to that end, over the last couple of years, I've been working really hard on accreditation issues, and now we're fully accredited. Franklin, by the way, is now accredited as a teaching hospital. It's a wonderful situation to say that our local community hospital is an academic training center. It's been fully accredited by the American College of Graduate Medical Education. And we have a residency training program, which has gone through a review and been accredited as well. So the training program itself, it'll be 3 years long. It'll train 4 residents per class. And so it'll be a total, once we're up and going here, of having 12 residents enrolled. And the program is based in a dedicated outpatient teaching health center. And the residents will actually work taking care of and seeing patients at that health center. There, they're going to be required to provide acute, chronic, and wellness care for a panel of their patients. And their patients will include infants and children and adults and elderly. And the health center training, what we'll do is we'll help to provide that behavioral health training, those common procedures I talked about, and an emphasis on understanding some of the social determinants of health and the community resources that are needed as part of that. So that teaching health center I talked about is currently the Greenfield Family Medicine practice. And we're undergoing a significant renovation of that practice in order to be able to accommodate the needs of having more providers in the area and having that education program that's there. Now, a lot of the benefits of this is the fact of being able to recruit people to come work here because of the excitement of being involved in an education program. And so we're going to meet some of these docs today as we go along. But before talking about our health center crew, I just want to mention that a lot of this has been really helpful to the hospital as well, and that we've been working with Dr. Empati in surgery, Dr. Mardigan Villamil in the medicine department, Dr. Talati in the emergency room, Dr. Polanski from the Pioneers Women in Health. Just a lot of excitement around being involved in an education program, and that also helps them as they recruit new providers into the area. So that's what we're all about. Hopefully, they give you a sense of family medicine and the teaching program. So we have been, and again, because of the excitement of being involved in an academic program that's associated with the medical school, it has really enhanced our ability to recruit docs into the area. And I'm going to just run through the list of docs that are now at the recently recruited to the Greenfield Family Medicine program, and then I'll come back around and ask some of my colleagues here to talk a little bit about some of the specifics as to what we're doing. Obviously, Dr. Peter Koppenheifer is our medical director, came here because of the excitement of being involved in an education program. Dr. Chandra Hartman is our residency director, actually recruited from Denver, Colorado to be involved in our teaching program. Dr. Nathan Macedo is our associate program director and actually a Massachusetts native, and interestingly enough, a former Tufts student who was rotated through Baystate, and great to be here. Dr. Deannabelle Castro is our department administrator and recruited here from New York City, which is really great. The excitement of being involved in something new, helping us to create this. Other docs that aren't on the call, though, that we've been able to recruit, Dr. Sherry Whiteson, she's our research director. We recruited her from Albuquerque, New Mexico. Dr. Emma Wood, she's a recent graduate of a program out of North Carolina. She's going to be our osteopathic coordinator and brought on board. And of course, there's been some folks that have been here right along, but they're here because of the excitement of the program. Dr. Katie Gerstile, she's in our practice, and she's recently taken on a new role with the medical students as the clerkship coordinator for the Perch track and really involved in medical education. We have Dr. Jeanette Tokars, pediatrics in the practice, is really going to help us to become our trainees, training them in caring for infants and children. And then, of course, Dr. Deepu Thomas, internist in the program, he also will be helping to precept as we go along. But part of this is the excitement of being involved in an educational program is what's brought people together with us. So I would like to, I thought it might be helpful for me not to do all the talking. And so what I'm going to do is ask Dr. Hartman, maybe you should introduce yourself a little bit more and talk about the excitement of what we're doing right now, what's going on in our the residency program.
Thanks, Bob. Good evening, everyone. My name is Chandra Hartman. I'm relatively new to the Greenfield and Baystate family, having been recruited to this program a little bit over a year ago. So I've been working with Dr. Baldor and Pete and Nate and everyone to build this program. And it's quite amazing how quickly and how smoothly everything has been going. And to speak to the excitement, what better way to speak to that excitement than to talk about interview season? In graduate medical education, we have a whole season dedicated to interviews. And that season runs November through January-ish, where we start to interview people for our residency slots. As Dr. Baldor said, we have 4 slots, and we're recruiting for those first 4 courageous pioneers to join us here in the Pioneer Valley and Greenfield Family Medicine. And just to give everyone a sense of what we're working with, for those 4 slots, we've had, as of today, over 940 applications for those 4 slots. So just a tremendous amount of excitement about this program and the work we're doing here. Obviously, we can't interview all of those great candidates. So we've been able to look through quite a few of the applications, and we'll be interviewing roughly about 70 candidates for those 4 slots. In March, we will find out who our 4 people are, and I can say with confidence that those 4 people are going, whomever they are whomever we decide on, are going to be wonderful additions to the group and to the community here. I think all of us who have been interviewing these candidates have been impressed and humbled by the caliber of candidates that we've been interviewing. These are people who are dedicated to community work. They really want to help. They want to be of service. They want to integrate within a community. They want to live in a community and work in a community. Many of them come from backgrounds very similar to Greenfield and Franklin County, and want to live and work in the area and become embedded within the community. So we're really gratified by that, especially as a new program, that we're attracting a caliber of candidate that's impressive, and I believe we'll be very excited to welcome our people and train them over the next few years. As personally, having come from a larger urban center, I've been practicing family medicine for close to 20 years. I've been in graduate medical education for a little over a decade. And I've been gratified and just very pleased with the level of support that we've had here in building this program. Things have gone well and gone smoothly because of the support of the hospital, the Baystate Health System, the community, the foundation. It's been tremendous, and part of why we can attract such a high caliber candidate is because I can say very honestly and truthfully that we have the support of this amazing system, and this is going to be a wonderful program moving forward. So with that, I think that's really what we're all about right now: interview season and being excited about these wonderful candidates.
Thank you, Dr. Hartman. Just to clarify a little bit, so it may seem like, wow, 900 people for 4 slots. But what's happened in the world of residency interviews, it's all gone virtual. And so people are, it's relatively easy for people to interview in a virtual world. So our interviews are all virtual, and we've had to learn how to do all this as well. So that's been a lot of fun. Although, you know, we always run into little glitches, and but it seems to work. So it's pretty neat, and really exciting just to see that excitement. You know, and part of this, as we look at this, we have a program that's brand new. We don't have a track record. We don't have you know, for proof, and so we're just so thrilled that even without that, we've had such a huge interest. Maybe I'll just kick this to Dr. Koppenheifer. Maybe you can just chat for a minute about what it's going to mean now that when the residents come on board, to have them, how would they be seeing patients in the practice? How would that go?
Sure, absolutely. Thanks, Bob. I'm Pete Koppenheifer. I am a family medicine physician. I'm originally from Pennsylvania, bounced around a little bit, going down to North Carolina for undergrad and medical school, and then out to Oregon for residency, but always wanted to come back to the Northeast. My wife is actually from Coleraine and was born at Baystate Franklin Medical Center. Her dad was born at Baystate Franklin Medical Center. So we've got deep roots here to the area, and very excited to be back here and practicing medicine, but also getting this family medicine residency program off the ground. That was one of the big things that attracted me to this area, was not only the family ties, but also the excitement of being able to start a brand new residency program. So as Dr. Baldor and Dr. Hartman were indicating, we will be having 4 residents for each of 3 different classes for a total of 12 residents once we're up and going. And they will be integrated into our Greenfield Family Medicine Clinic. They will each have their own clinics where they will be seeing patients on their own, initially not very often, maybe 1 per hour as they're first getting started, and then kind of working up towards a more normal schedule. And they will be closely precepted by many of the faculty that you've already met, as well as many of our other excellent family medicine colleagues who will be able to review each and every case with the residents and be able to go over kind of the important learning things from the case and make sure that the resident is following along with all of the evidence-based guidelines. If there's procedures that need to be done, we'll be able to help assist them in learning how to do those procedures, and then having them be able to do the procedures as well. So we're really excited both for the residents to have good learning opportunities, but also for our patients, because it's really exciting for patients to have kind of cutting edge academic medicine in the foothills of Western Massachusetts. So we're really excited for the residency program to be able to kick off, and for our first class to be announced coming up here in March.
Excellent. Thank you, Peter. One of the things that people have often asked me is, why would somebody want to see a resident? So first of all, I need to understand residents are MDs. They're fully trained. They've graduated from medical school. And for my 30 years plus when I was in Worcester, I came to find out that patients loved having a resident for a couple of reasons. One, residents spend a lot more time, as Peter was saying. You know, they tend to they're scheduled for a lot more time, and part of this is their learning. And the other part of it is it's a twofer. There's always a seasoned attending in the back room with that's there to back the resident up, and either we'll just talk with the resident about what's going on, or they may even come into the room and if it's a more complicated or particular issues. So people really tend to, once they understand and get engaged in an academic training program, to realize the value of being with the residents. Now, any of you may have heard me speak in the past. I've said, you know, there's that saying, it says it takes a village to raise a child, and I've said it takes a community to train a family doc. And that's that community hospital with all the specialists that I mentioned before being engaged, but also the community at large, because it's important for us to really understand issues related to social determinants of health and the community in their place. So I'm going to ask Dr. Macedo to speak for a little bit. He's actually been really engaged with the medical students to this point, and thinking about helping our medical students to understand these and give a sense as to what does that actually mean for our training. So Nate, can you chat about that for a bit?
Absolutely. Thank you, Bob. So, part of the training and one of the definitely drawing aspects of why family medicine that we talk about with all our applicants is being involved in the community. Our applicants now in medical school know that there's only so much that your family doc can do within the 4 walls of the clinic, and that it really is a team sport. And so for the last couple of years, being an attending physician at Greenfield Family Medicine Practice, we are always in communication and collaboration with our ancillary services, whether that's just within our Baystate Franklin medical family, but also thinking about the community and their needs at large. A few of us have sat on with the Franklin County and Northern Quabbin Region Opiate Task Force to address substance use disorders in our community at large, and our residents are going to be heavily involved and embedded in that program as well. We've worked with the YMCA of Franklin County, the Franklin County Regional Council of Government, just kind of, and also connecting with other community programs and other affiliate partners, the VA, Poet Seat Nursing Home. So our family medicine residents are going to get a robust training and get to really know the community that they probably will also live in as well. Talking to some applicants, even just earlier this afternoon, when I always ask them, talk to me about your ideal practice. And as they're describing where they'd love to live and work, and a lot of them tell me about they want to be that country doc that, that they see their patients, that, maybe the farmer that they buy their produce from, or go see a concert later in like on the weekend and run into their patients. They really want to be involved. And it's been exciting to meet other partners in Franklin County. And I've been telling my patients all along too that, it's really exciting that residents are coming next summer. This means that, we're going to have more doctors to fulfill the needs that we see around the area. And it's also going to keep doctors like me around who want to be their teachers. So I think everyone is very, very invested and excited about this.
That's great. Thanks, Nate. So one thing I just want to comment, talking a lot about doctors, and once we're fully functional, this is a teaching health center. This is going to be a multidisciplinary approach. We'll be also taking on other learners, whether that's nurses or psychologists, social workers, and so on. I want to just give Danabelle a chance to say hello. So, all these things happen. You need somebody who is there to hold it all together and make it all happen. And, we get the limelight, but really, Danabelle has been remarkable since she's joined us and helping to make all of this happen. You want to just say hello and introduce yourself, Danabelle?
Hi, as Dr. Baldor said, and by the way, thank you for the honorary doctorate from earlier. So I am the program administrator. I started about 6 months ago. I spoke with Dr. Baldor a bit ago, and he sold this to me. And as everyone has said, I mean, just everyone's excitement was infectious, and I just had to be a part of it. Very interested in being a part of the residency program of the future, right? We don't have a track record. We don't have to stick to what everyone else does. We're pioneers in that way. And nothing, I mean, I'm just excited to be here.
Excited and so lucky to have Danabelle join us. The other member of the team who's not here, of course, is Rhonda Cowat. Rhonda's actually been at Franklin for 30 plus years, and she's been terrific in helping us move things forward and been a real special. But I think that's sort of the end of the sort of prepared comments, and I know we can throw this open to questions or other thoughts and different things that the people wanted to ask about, or I'll toss it back to you, Scott.
All right. Thank you, Dr. Baldor. Let me just start with this. This is really exciting. You guys are really excited. This is really, the way you are so excited about this program certainly gets me excited. And just the idea of coming back to the area of Western Mass, and Dr. Koppenheifer, again, I'm going to get all these names right over time, I promise. It's kind of fun. It's kind of fun to come full circle for your family to come right back to Baystate Franklin Medical Center. So this is great. For those of you who might have missed, my name's Scott. I'm the executive director of Baystate Health Foundation, and you might wonder why is a foundation here? We're here because Dr. Andy Artenstein, who's our chief physician at Baystate Health, knocked on my door one day and said, we would love to get some funding to get this program going. No good program really starts without some seed money, and there are some significant renovations needed, which I'm sure we can talk about in a few minutes. So we've been, going out to the community and asking for some support. And as of today, we've raised just about $250,000 toward a goal of $750,000 to support this multi-million-dollar starting program. And a special thank you to Greenfield Cooperative Bank and Freedom Credit Union, the William D. Russell Fund, and the Baystate Franklin Medical Center medical staff for their support. It really does take a whole group to make this work. But what I'm going to do now, we did have some questions submitted ahead of time, so I'm going to just Q&A seem to I can ask a question everybody's thinking, I guess. And please forgive me if this has already been said, but sometimes it's just people want to hear it twice. So I'm going to go to my questions right here. first question, no specific order, so these are all random. So will the Department of Family Medicine work with primary care Baystate medical practices in the area?
Yes. So what's happening, and talk about primary care, and I try and define a little bit what's family medicine versus primary care. Primary care medicine has primarily been internal medicine specialists caring for adults, and what we're seeing across the country is those folks aren't going into primary care anymore. So, for example, many of you know there was a practice in Turner's Falls where there were 3 or 4 internists there, and they all retired. And part of the major emphasis for this program that we're developing is we've not been able to recruit. You can't find primary care internists anymore. They all go on to specialize and become ologists. That's a blanket statement, of course. But and so what we're trying to do is to grow our own family docs as primary care specialists involved. But we're into collaboration, and there are other folks that are around. There are other practices that are not just Baystate. And we're about collaborating and being engaged and helping everybody. I mean, my job, my initiative here is to raise all boats, and so we've actually been helpful with trying to do some recruitment. So, like at Valley Medical, at the community health center, and so on, and we'll engage them as we go along. We've engaged those groups already in getting medical students out there so that they can see these other sites. And so, yeah, this isn't just about our practice. This will become the nidus of this in the center, but we're totally looking forward to and wanting to and working with all the folks in the area.
Great, thank you. And this is a combination of some questions that were submitted. This one just came in from somebody. Can a single person with no family do family medicine?
I'm going to ask Dr. Hartman to answer that one.
Absolutely. Families come in all shapes and sizes and forms. Don't have to have, although our specialty is designed to care for the family unit, we certainly care for all ages and stages, as they say, cradle to grave. So, and you can see all the docs on the panel just kind of nodding, because that's really, those are our foundational principles. All ages and stages, wherever you come from, whatever you need, whatever you bring through the door, we're going to be ready to take care of. And if we can't, for whatever reason, we're going to find out who can and help you get there. And that's, in my view, the most amazing part of family medicine.
Thank you very much. Here's one that obviously a lot of people have questions about. Will it be easier to book appointments or get same-day appointments?
I would say we certainly hope so. That is one of the biggest draws of having a family medicine residency program, is to be able to bring more providers into the community, both while they're actually serving as a resident with our residency program, but also into the future. So one thing that residency programs across the country have learned is that fairly large proportion of residents after they graduate end up staying in the community or surrounding area from which they graduate from. And so we're really excited both to expand our access to having resident appointments, but also with bringing more physicians into the community long term beyond just their time during their 3 years of residency.
Great, thank you. Questions are coming in quickly, guys, so get ready. When will the program be seeing patients, and what is the timeline?
I'll take that on. So it's a building process. We will be renovations will be starting up here soon here after the first of the year. The residents themselves will arrive in July of 2022. The first 4 residents, and they'll be interns, and then that'll build every July. We'll add another 4. So it's going, and the first year, really, the interns are primarily in the hospital setting, not spending a lot of time in the health center. So realistically, this is a long-term investment, probably July of 2023, before we really are having a really robust presence and to really be, sort of fully functional at that point. But as you've heard, we've already brought new docs in, and we're already having increased access and more availability just from our faculty that are on board. And I'm hopeful to grow that a little bit more here. We'll see here over the next year.
I know one of the goals we've been talking about is bringing more physicians to the area. Somebody just asked, how many physicians are there in Greenfield? Do we have an idea how many there are currently?
Ron, do you know that?
I do know, I can't remember off the top of my head how many primary care we have over Sanderson Street, which is our medical office building across the street from Baystate Franklin Medical Center. There's quite a bit over there. And then the specialists, I mean, they rotate through from Baystate Health. And I mean, there's a cadre of them. We'd have to look that one up, Scott, to get the
I would say we have a slide with our applicants based on the Franklin County Community Health Needs Assessment from a year or two ago. And the current data is about 1,500 people per physician in terms of need in Franklin County, which is almost double what it is in the rest of Massachusetts. So I don't have absolute numbers, but that speaks to the need of, the unmet need in Franklin County for primary care physicians or primary care services in general.
Another question, unrelated, somebody just wrote in, we mentioned academic medical center. So what are the benefits of having an academic medical center in the community? What does that mean?
And I talked about that. So basically, it means that folks have a relationship back to the medical school. And so there's medical students involved. There's other students that are in the institution, the residents there. So what that does is it challenges the physicians, the attendings that are there to make sure that they're up to date and that they're current with what they're doing. It challenges them, but also all these learners bring in the latest information. And so basically it increases the quality of the care that's being given. It's oftentimes the care is much more evidence-based in its approach. So it's sort of it's a quality marker. Folks actually end up getting faculty appointments, become on the faculty at UMass Medical School as part of this. And so there's a feedback loop that's constantly going on. So that's probably the best way to describe what it's about.
And Dr. Baldor, one of the things, and I've been lucky enough to see some of the floor plans that have come together. Can you talk a little bit about the construction? What's it actually going to look like? So the practice.
Well, let me talk about the teaching space. So teaching space, we obviously, if we're going to have 12 residents, we have to have a space for them. We have to have more medical students around. We have to have a space for them to be touching down. But part of this is, as we develop that teaching presence, we talked about the fact that when you're seeing a resident, it's a twofer. You get the faculty person, that attending that's there. So we have had to build out. We will be building out precepting rooms. So just adjacent to the exam rooms in the clinic where the practice where patients are being seen, there is a precepting room or an attending. So for example, like myself would be there. The residents would come in and would be talking about the patient situation. We would also have that totally set up to be accessible for resources, whether it's current textbooks we pull off the shelf or whether we're doing online searches to look up interesting facts, whether it's medications or so on. We'll also be developing a teaching room, a hall, so that we're going to be having workshops and so on for the residents, since we need a space that's there to accommodate that little lecture procedure workshop room as part of that. The other part of this is renovating the clinical space to accommodate the care in a little different fashion. And Peter, maybe you can talk about kind of what's the idea behind renovating the clinical space.
Sure, absolutely. I would say that we have had very dedicated providers and staff who have been providing excellent care here in Greenfield to our patients. but the facilities don't always reflect the degree of care that we've been trying to provide. And the space is just a little bit outdated and doesn't allow for having the physical space that we need in some cases, but also the IT support and the aesthetics that are appropriate for a modern family medicine clinic. And so what we've been working with Dr. Baldor and the hospital and the foundation is figuring out a way to kind of upgrade the facilities to reflect the high level of care that's already being provided.
Great, thank you very much. I think we have time for a couple more questions. Here's one that just came through too. Will I see the same doctor each time I go to the practice?
I can take that on. You know, it's really, it's interesting in that medical care has become a team sport. It's probably the best way of saying that. I think for years people would go to a private practice and see the same doc over time. And what has happened now is we have a variety of providers, whether it's physician's assistants or nurse practitioners that are into practice. So what we try and do is schedule a continuity visit with your primary care provider. And so people who have chronic diseases, the best care you get is by linking up, getting to know a provider over time and seeing that person maybe, you know, 3 times a year, something like that. However, if you're acutely ill and you got a sore throat, well, maybe your regular provider is booked. You want to be cared for, and that continuity is as important for that acute problem. So you're likely to come in and see one of us who's covering rather than your regular primary care or one of the PAs or the nurse practitioners or somebody of that nature. So that's generally the nature of what this would look like. But ideally, it would be to link up with a primary care person who gets to know you over time and can see you 2 or 3 times a year for helping to care for your chronic conditions and be there for you. I don't know, Dr. Koppenheifer, you want to comment any more on that, sort of as the medical director seeing the flow of patients, but generally that's kind of how things will play out.
Yeah, sure. I think that is very similar to what my thoughts would be. But the other thing that I would add on is we try to have a team model where a physician kind of pairs up with 1 or sometimes 2 advanced practitioners that work closely together and collaborate together. And so oftentimes if you're not able to see me as your primary care physician, we'll be able to work you in with one of the advanced practitioners that works closely with me. And that way you do build up a relationship not only with your primary person first and foremost, but also with some other providers in the office, and try to maintain as much continuity as possible. And as Bob was indicating, there's certainly going to be times where, you know, just getting in to see anybody is going to trump that continuity. But as much as possible, we like to try to maintain continuity with the kind of central primary care provider, but then kind of expanding out from there as necessary to include that provider's team, and then if necessary to the clinic at large.
Yeah, a good friend of mine is on this call. I just got a text. They're asking, what is the cost of the program and how much is Baystate Health investing in this?
So, yeah, I mean, that's an interesting question to ask, and I can't give any specifics. But let me tell you, though, the way graduate medical education is paid for, believe it or not, is from Medicare. And this was also a big piece of getting Franklin accredited as a sponsoring institution. So once they get accredited as a sponsoring institution, they then are eligible to bill Medicare for the cost of the training program. So the resident, significant, again, it's a ramp up. It's going to be 5 years before that all happens. So we're trying to get the program up and going. But Medicare will support a lot of the resident expenses. I don't have exact numbers for you as to what it costs, but it ends up being a shared process. So Medicare helps. Obviously, the group, the practice as it's seeing patients and generating buildings that offset some of it as well. The hospital itself will be incurring expenses though for some of the basic aspects of what's going on. And so it's that's it. We did talk about the renovations being a $4.5 million renovation. So and we're hoping to raise $750,000 from the community to help with that. The rest of that's going to be coming from Baystate. So in general, hopefully that helps to answer the question as best as I can.
No, it sounds like a significant investment from Baystate Health. That's for sure. Hey, Dr. Baldor, I'm going to leave you. I want to just, we're talking about today. I guess I'm going to direct this one right at you. Let's think 5 years from now. What are you hoping to see in 5 years from now with this program?
Yeah, I've been so thrilled to be here and develop this program. And we're starting with this basic program here to get the residency up and going. 5 years from now, though, I see us actually expanding. And so what happens is once you get that core program down, then you can actually develop some additional training programs on top of that. Those additional training programs are called fellowships, and there's some need in the area. So, for example, training folks a little bit more in addictions medicine, training folks more in geriatrics as piece of it, perhaps training folks more in dealing with sports medicine or orthopedic type of procedures. And so we'll be looking at the other piece of this, of course, is behavioral health. Maybe a joint program with psychiatry. There's an interest in folks training in psychiatry and family medicine, helping with that interface. So those are things we're looking at. We'll be thinking about as we go down the line. But the other part of this is to really have a robust presence within the community. We'll love to think about how do we actually link up with some of the other, we're talking about the medical school here, but how do we actually link up, say, with Greenfield Community College to be able to provide, help them with the resources to be training the different practitioners that they're nursing students and so on that are part of that. Can we link up with some of the other programs around to help train some of the pharmacists as well? Bringing more learners into the area, training them, and they get exposed to the area, and then they're staying in the area and being involved in the hospital here and in the community. So that's the broad vision for this. So get past this next year here of getting the residency solid, we'll begin to be looking at those next pieces.
Right. Sounds very impactful. Well, I'm going to bring it home now. Two things that really stuck with me. Dr. Hartman, I got to say, 940 applications for 4 spots. No matter how you slice it, that's incredible. That's it's going to be 4 brilliant people that come into the program. I can tell you that much. And then I think the quote of the day for me, I'm going to use from now on, is all ages and all stages. So it kind of just answers a question in one sentence. So that's really, really thoughtful. I want to thank Ron Bryant, good friend, Dr. Baldor, Dr. Hartman, Dr. Koppenheifer. I'm going to get that right from now on, I promise. Dr. Macedo and Deanna Bell. I want to thank you all for taking the time tonight to be with our guests. And I want to thank everybody for and a special thank you to Christina Cronin, who's really leading this effort from the foundation on the fundraising side, Kate Roberts, and then Clinton Vadnais. We couldn't do this without Clinton behind the scenes with all our video production. So thank you very much for joining us, and thank you for your support. And if anybody's any questions, feel free to email anybody. All our names are at Baystate Health. We're happy to get back to you anytime. So everybody have a wonderful night. Thanks for coming.